You so much. It's lovely to be here and to be able to kick off the presentations. So my background is in psychological science, but I've worked a long time on improving methods and statistics in my field and social sciences in general. And I want to talk about one way to do this potentially in the future, which is methodological review boards. So the main way of quality control in science currently is basically peer review. That's often the stage where people who submit their work get criticism of colleagues or peers for the first time. And this is an important process, of course, in terms of quality control, because errors are pointed out and as far as possible improved. But it is also slightly weird that we do this when most of the work has already been done. So it's kind of peculiar that we criticize, especially things like the method and the design of a study, when it is actually too late to do anything about it. Of course, you can tell peers that they have to change their interpretation of data, or maybe that they even analyze it in slightly different ways, but they often can't do much about the way that the study has been performed. So the problem here can be relatively small. If everybody designs perfect studies and if everybody creates studies that have high informational value, then having criticism at the end doesn't matter so much because there's not much to improve anyway. However, if you feel like the quality of scientific work is actually quite low, then there will be a lot of research waste if we can't fix it earlier on. Now, the main reason that I started to think about this topic is that I'm the chair of the ethical review board at my university. So we see a lot of the work that our colleagues do. And as we evaluate the impact on people and whether there are ethical concerns, we often also notice aspects of the design that we are, in my field, generally in psychology, but also the way that our ethical review board is set up, that we are not commenting on. So sometimes internally, we will remark, well, they are not electrocuting anybody for no good reason in this study, but they are performing a study for which they will not learn anything. So we might remark this, but we can't do much about this. So one way to prevent this type of waste, that people perform studies that essentially are not able to answer the question that they set out to address, is to solicit criticism, especially on the methodological aspects of a study before the data is actually collected. Because at this moment, you can still change aspects of the design. Now, the way to solicit this criticism can depend on what you think works best. There are a couple of possibilities. I'll briefly mention two, but the talk is about the first, so introducing methodological review. But there are other ways that also work. So I won't talk about them much, but I'll briefly mention them. So one is something that we call a red team approach. This is where you basically have internal critics as part of your project throughout the project. So these are collaborators that look along every part and every decision that's being made. They try to criticize everything that a team does. The concept of a red team comes from software development, where software engineers will try to hack the work of their colleagues to see if they can break it or break into some system. But it's organized within a collaboration. And then before they go outside to the real world, it has already been very severely tested. Another more novel approach that is becoming more popular in my field is peer community in registered reports. So registered reports are a format where people submit the method and the analysis plan and the theoretical introduction to a journal. This is then peer reviewed, but this happens before the data is collected. So then the peer reviewers can also say, hey, this is what we think you should change. Now, this process is a peer review process, so you send it out, it takes some time, you get it back, so it's a more lengthy process. The peer reviewers are outside of your institution. And in methodological review, there's also this check, but it happens through an internal committee. And in that sense, it is very similar to an ethical review board. You might even feel like you can combine them. That's not my recommendation, but if you feel that the people in the ethical review board are also expert methodologists, then you might be able to combine it. But here I am actually suggesting that this works in a slightly different way, where every department has its own methodological review board of people who are experts in a specific area. They look through studies that are about to be performed. It could be part of the general process of making a data management plan, getting ethical approval, and then getting methodological approval. So why would we need something like this? Because as the chair of the ethical review board, I know that people are generally not super excited about having to go through such a process. And now I am proposing that we add another process. So we add a methodological review board. So I understand that this is not going to be a very popular thing among many of my colleagues. Why would we nevertheless consider introducing something like this? The current approaches that we've tried don't really work very well in terms of trying to get people to increase the quality of things like their methodological design. For example, what we've tried mainly so far is to create checklists. And these checklists are there to help guide people through things they should consider and think about when they design their study. So they should think about all these things in advance. They often forget, but a checklist can help them to remind them. So an example of this is the SPIRIT checklist, which has been developed for interventional trials. Now, this is a great checklist, and if everybody would follow it, then most studies would be of higher quality. But researchers regrettably either forget to fill out these checklists, or when they fill them out, they don't really know how to do it well, often because they might lack some expertise. So they might not have the knowledge that they need to do a very good job at filling out all these aspects about the checklist. So in this case of the SPIRIT list, what is in there? Well, for example, questions about the sample size justification, the analysis that people have planned, how they will deal with missing data and how much they think there will be of it, the exclusion criteria, measures, including some things about reliability and validity. So all these aspects are important to think about in advance. If you forget some and you mess them up, you could end up with a study that is not able to answer the question that you set out to test. Now, how do we know that people don't do a very good job at filling this in? Well, there are some journals, such as the journal Trials, where they have dedicated protocol editors. So these are people that don't peer review the paper, but their only goal is to check whether this checklist has been filled out correctly. And there's been an evaluation of this practice, and this is from a paper that describes what they've learned from being protocol editors for a while. And they write, after 6 years, not even 2/3 of all items are adequately reported, not even 2/3 after 6 years. So people have been trying this for a long time. So that's not very good. It even gets slightly worse if you aim for a perfect score. It says, and the investigators found no protocols among the 150 from 2019 that addressed all items. So for some reason, it turns out that this is actually very difficult for people to do well. They also note that it's a little bit frustrating to have to be a protocol editor, because very often the moment that they actually look at these protocols when they're submitted to the journal Trials, these studies are already started. So of course, if they see anything that is not just not filled in, but that is incorrect, something that can be improved, it is too late for them to do something about it. And if you've been a peer reviewer and you really like a study, but you read it and you think, oh, if only I had been able to warn them about this thing before they collected all of this data, then this is exactly the same experience. Now, in my own field, there are also these kind of checklists, and they're just rarely used. No journals have protocol editors. People don't follow them. But if they would follow them, again, the quality of the study would very often increase. Now, what I'm proposing in terms of methods review is basically whether the study that people have designed can actually answer the question that the researcher is asking. And for some people, this feels like a very low bar. But if you have a lot of experience as a peer reviewer, you might figure out that this is a problem that actually occurs. Now, in many cases, it might just be as simple as too small a sample size to gain informative results. But it can also be that there are real confounds or other issues with the study that prevent the researchers from actually answering their question. And we could have seen this in advance. So introducing something like this is not just helpful for the reviewers, but you could even consider this an integrity issue, at least in our code of research integrity that we have in the Netherlands. It says, make sure that your research design can answer the research question. Again, you might find this such a trivial thing to notice, but if you look at some studies, regrettably, this bar, low as it might be, is not always met. So when I introduce this idea of methodological review boards, there are typically two types of responses. Some people say, this would never work. In my field, it doesn't exist at all. There are basically no places where this exists. And these people say, this is absolutely impossible. You could never get it off the ground. It would be highly problematic, etc. The other response is the people say, we already have one. What's novel about this? Why are you discussing this? Because we've had it for some years. It's fine. We've gotten used to it. Now, both of these can be true, of course, depending on the context. In some places, it might not work. In some places, it might work beautifully. In all fairness, I have to say that sometimes when I talk about it, you actually get a third response. So people feel quite sensitive about being told what to do, especially if this is accompanied by first saying what you're doing is not good. You designed a study that is not high enough quality to perform. People just in general don't like it, so they might be a bit more harsh in their evaluation and want their freedom. They don't want somebody else to meddle in what they want to do. So should we do this or not? Well, your choice will depend on a couple of factors. Do you think that many studies that you have in your institution would be improved by this, or not at all? Do you think that people who need it the most will search out this voluntarily, or do you need to force it on them? Will it add value in general for studies, or only for very few, and then you're checking a lot of papers, but it's basically for nothing? Are you a fan of sort of top-down regulation? Many scientists are not. Do you prefer it if people self-organize this process in some way? I mean, not the methodological review, but just they are in charge of the quality of their study. Do you think that other people can improve your research? I think many scientists think that they are the people who know best, although some others might doubt this, but this is also a question, of course. Do you think people are convinced? It's important to also note that what we're going to do in the methodological review board is not really fight about things that statisticians like to fight about, like, are we going to use Bayesian or frequentist statistics? Again, the only focus should be, can the researcher answer the question they have with the study they have proposed? So is there a coherent and well-justified argument for why they do what they do? It is true that more controversial topics could pop up. So I think that a very valid question is to ask, well, what about the measures that people use? Again, this might be more important in my field of psychology. We have so many different measures and not all of them are well validated. So is this part of what a methodological review board should look at? Should they require evidence for the validity of a questionnaire? Then we would have a problem because not many studies would be able to proceed. So ideally, maybe yes, but also, of course, you need to be ready for it. So I don't propose that we go all the way in. We can slowly start and improve what is feasible to improve. Now, again, the only focus should be really this question. Can you answer the question that you have? Now, you might also think this takes a lot of time to evaluate, so maybe we don't want to do it for everything. Should we do it for all studies or only those that are very expensive or that have very sensitive populations that are being studied, for example? How do you want to set it up? So some institutions have a very combative ethical review board, and these people don't want also a combative methodological review board. I would propose a much more cooperative, helpful board where if you turn something down, you actually help people to improve it. So of course, we have to figure out what the costs are and whether it is worthwhile to implement. And one way to evaluate this is that researchers should actually experience a benefit of a methodological review board. So I would propose to study whether it actually has this benefit. And benefits should be that their papers get accepted more quickly at better journals, because that should be correlated with improving the quality of their work. And if you achieve this, then maybe over time, people feel that it's actually valuable for them. There's another benefit I would like to briefly point out, which is that it's nice for young researchers to have a career as a methodological review board member. So this could be a job for people who love to do methods, who love to make the research of other people better, but they're not per se motivated to improve their own research or have their own research line even. And there are not a lot of career options for people like this. Just to conclude, so in my experience, because we have done this internally at our department for a number of years, in the beginning, often people see it as a hassle, but after a while, they actually have to, maybe grudgingly, admit that it has increased the quality of their studies. It's a good way to train people for best practices. And altogether, I would say it deserves to be studied in contexts where it's not implemented yet to see if it achieves these benefits. All right. Thanks so much.